The average person in the U.S. will live to celebrate their 76th birthday.
There's a 30% chance you will see your 90th birthday, and more people than ever before are making it to 100.
But there's a big difference when it comes to how long you actually live when you're Black. A new study reveals 8 factors that play a role when it comes to race and mortality.
As TV5's Colette Boyd reports, it may not come down to just the color of your skin.
Making it to 100 is something to celebrate, but making it to 100 when Black is even harder. A new study out of Tulane University reports Black adults who live in the U.S. have a 59% higher risk of premature death than white adults.
We wanted to do a big study to try to see if we could explain what is actually responsible for the differences.
Epidemiologist Joshua Bundy believes disparities in 8 social economic factors are to blame, and they are all interrelated.
And those who don't have any high school education at all are at the highest risk.
Education impacts employment, which impacts health care.
Maybe you then don't have access to health insurance.
Income impacts access to healthy choices.
There are good interventions for food security, like providing food assistance programs and things like that.
The study found home ownership is an indicator of what people can and cannot afford. Even marital status matters.
Being married may offer social support. There has been a lot of debate on whether this is some kind of genetic reason, if it's based on your genes, if it's something that's predetermined or because of biology, or even just things like behavioral and lifestyle factors that may be different. But what our study is really saying is that it's really explained all by social factors.
Bundy believes by knowing how these things impact our lives, we can work to build systems to solve these disparities and hopefully see more people of all races live longer, healthier lives. I'm Colette Boyd reporting.
CDC is also focusing on social determinants of health with their Healthy People 2030 initiative.
They're using data-driven facts to help policymakers address race-based mortality gaps for the next decade.
Professor Bundy says there is zero difference between Black and white adults for mortality risk once these 8 factors are dealt with.